Hi, welcome to those who are joining us. We'll just give it a minute or two to let everybody in, and then we'll get started. Welcome everybody. Do feel free to introduce yourself in the chat. And we've got the Q&A function ready for when the presentations begin if you have questions. Hi everybody, welcome. We're just giving people a few more minutes to join. It says chat is me. Right, perhaps it is. I see chat disabled. Sorry about that. But Annabelle is behind the scenes and she is working to help our panelists join the usual technical hitches. So perhaps once she's done that, she might be able to enable chat. But at least we have the Q&A function. And thank you to those who are joining us now. I'll literally give it one more minute and then we'll get going. Okay, well, I don't have much sort of housekeeping announcements. I think we can basically launch right in, but just to say welcome. And this is normally a quarterly call that we have with the Global Adolescent Nutrition Network, the GAN, which is a network that anybody who's interested in this topic is in adolescent nutrition in general is welcome to join. You can find the link on ENN's website, or I'm sure we can post it in the chat at some point during the call. But today's webinar is, we've opened it up to everybody, so it's more of a webinar style than our usual informal call. And we've got a presentation by myself on a chinry that we did. Then we have Steph from ENN who'll be presenting on more of a research roadmap where we've kind of detailed a pathway to answering some of the top research questions that came out of our research prioritization exercise. And then hopefully we'll have some Q&A and some comments on research priorities for nutrition of adolescents and school-age children more broadly from some great panelists who hopefully are able to join. Having some slight issues right now, but we have Caroline here and we're waiting for David and Deepika. We are recording the session, so yes, you'll be able to watch it again or share it with others who aren't allowed to join. Okay, let me get going. Yeah, there'll be an opportunity for questions at the end of all the presentation. So if you have a question sort of come up early on, then feel free to put it in the Q&A thingy bob, and we'll get there at the end. There should be hopefully plenty of time. Right, let me get going. So as I said, I'm going to be just giving an overview to our research prioritization exercise that we did last year, early last year, even towards the end of 2021. And it was using the Chinri methodology. So, as I'm sure I'm already talking to the converted and the knowledgeable, but there is growing recognition of the importance of adolescent nutrition, but it still is very much an under-researched and under-invested area. We find that there's a lack of data, a lack of intervention studies, policies, and targets for nutrition for school-aged children and adolescents. So that covers a period of age 5 to 19 years. We had the wonderful Lancet series on adolescent nutrition, which came out towards the end of 2021. And that really set the scene and summarized the current burden of malnutrition for that age group and the status of programming. And so we wanted to move forward from that in order to stimulate and guide further research and generate this list of research priorities for the next 10 years. So just a quick summary of the Chinri method. It stands for Child Health and Nutrition Research Initiative, and it aims to prioritize health research investments. It measures the collective optimism of a large number of stakeholders towards various components of a long list of research ideas within agreed context and agreed criteria. So it's a systematic method that generates consensus, it engages a wide audience, and it provides evidence to catalyze research, hopefully. So the steps that you generally take are to set up an expert advisory group, define your context, list all the possible research questions that you can think of or that you can find in the literature. Then you define some judging criteria and you run a big survey and hopefully get a couple of hundred respondents and to rank those, and then you can analyze and disseminate the results. That's basically what we did. So the context for our Chinri was a population of 5 to 19-year-olds. We also disaggregated by 3 age groups because obviously 5 to 19 is a very broad and heterogeneous group of individuals. So we disaggregated by school age and then early adolescence and later adolescence. We also wanted to disaggregate the questions by those aimed at in-school adolescents versus out of school, because that's quite different. And also we had a separate section on pregnant adolescent girls. The disease, as they call it in the Chinri method, was all forms of malnutrition in our case. So we included micronutrient deficiencies, thinness, stunting, overweight, obesity, and suboptimal dietary quality. We focused on low and middle income countries, including subnational, national, regional, and global level. And our timescale was to achieve measurable results in reducing the prevalence of malnutrition for this age group in the next 10 years. Our judging criteria that we asked the survey respondents to judge the questions on was how answerable are they, how effective would the resultant intervention be, how deliverable would the intervention be, and would it help towards equity. So we had 285 people register for the survey, and 116 of them completed at least one section in slightly different groups. We had the option to do it in French and Spanish, and we had a small number who took that up. The questions were randomized in terms of the order that they appeared to each of the respondents. So if you didn't finish the survey, it didn't bias the questions towards the beginning versus towards the end. It was a very long survey, and Chinris generally are. We wanted to see if we got any young people themselves doing the survey, and about 3% of respondents were younger than 25. And they came from a broad range of countries, representing 38 different countries, and a broad range of organizations. And you can see from the pie charts here that we did have good representation from lots of different regions, although Latin America and the Caribbean was probably a bit underrepresented, as was the Middle East and North Africa, and East Asia and the Pacific region. And then we had a lot of people who worked for NGOs, also UN agencies, academic institutions, also governments. We had few from private sector or donors. And this was the main results. So this was the top 5 ranked research questions, 1, 2, 3, 4, 5, and the number 6 was the top for out of school adolescents, because they weren't very well represented in the top 5. So we felt it was important to put in a number 6 there as well. So number 1 was, how should antenatal and postnatal care interventions be adapted to effectively support pregnant adolescent girls? Number 2 was, what are strategies for effective delivery of interventions in schools? Number 3 was, what strategies are effective at involving school-aged children and adolescents in defining their own solutions? Number 4 was about effective behaviour change communication strategies. Number 5 was about improvements to local food systems to support healthy school environments. And number 6 was about optimal partners and delivery platforms besides schools to reach out of school adolescents. Now, Steph's going to talk about each of these in more detail in her presentation. So that's just an overview. A bit more detail on the results. So of the top 10 questions, the research questions that were ranked, half focused on delivery strategies and half focused on improving existing interventions. So there was also quite a lot of descriptive questions and also more kind of discovery type basic research questions, but they were not the focus of the results. People were more interested in how we deliver known effective interventions or how we tweak existing interventions. In terms of the age disaggregation, I said we had those 3 categories. There wasn't very much difference in the order of the questions based on your age. I can say that for the oldest age category, so the 15 to 19-year-olds, there was a question that was ranked more highly on food choices, whereas for the younger age category, it was more about school meals. So I think that makes a lot of sense. And in terms of in-school versus out of school, the in-school questions ranked more highly and they had a greater expert agreement. So more people felt that they should be ranked highly. And that's probably just reflective of the little we know about how to effectively reach and improve nutrition for out-of-school adolescents. In terms of regional disaggregation, again, there weren't very many stark differences between what regions the respondents came from and what questions ranked the most high, but there was some differences. For example, in South Asia, there was a question on effective integration of nutrition programs with sexual and reproductive health programs that ranked highly, which it didn't in the other regions. And those from Western Central Africa ranked a question on cost effectiveness of macronutrient supplementation for thin adolescents more highly than they did in other regions. And then I said we have a separate section on pregnant adolescent girls. So these were the top 5 questions for that. The tailoring of antenatal and postnatal care was at the top, which was also at the top overall, as I've already said. There was a question on risk factors for impacting nutritional status of pregnant adolescents, specifically in humanitarian contexts. There was a question on the most acceptable and effective strategies for implementing daily MMS. And there was a question on the benefits of delayed early pregnancy for adolescent girls. And number 5 was about standard interventions that have been shown to be effective and cost effective for all pregnant postnatal women, as well as adolescents. So quite similar to number 1. You can see the details of all these results in a paper that's being published today in PLOS ONE. I haven't got the link right now, but I should have by the end of the day and be sure to share it with everybody. So we also explored other categories in terms of rankings. So the most answerable was also deemed to be the most effective and the most deliverable, and it was about delivering interventions in schools. We know that 80% of the school age and adolescent population are in schools. So it makes sense. That is quite a, should be the starting place for a lot of interventions. In terms of the one that would improve equity the most, it was about postnatal and antenatal care for adolescent girls. And then I also wanted to highlight the highest ranked discovery question, because these didn't feature in any of the top 10, but it was good to note that it was about standardized indicators that should be used to assess the impact of nutrition interventions. So anthropometry only tells us so much, especially for this age group, who are quite difficult to measure, have a lot of spontaneity within their growth spurts, etc. So what other indicators can we use, like school achievement, productivity, well-being, etc. So in summary, overall, the top priority questions were similar across the different age groups, and they focused on developing and delivering existing interventions. We believe this reflects the current knowledge base. We think there's been some efforts to date to establish the needs and burdens of adolescents, so to describe the problem, and to advocate for their inclusion in global research and policy. But we want now to go to that next step where we identify and deliver effective interventions to tackle the problems. And the survey suggested that we should be thinking about nutrition interventions that can be, that should incorporate implementation research. So how to deliver something, and that might be less of an academic research and more of an NGO-focused program that we learn from each other about how best to deliver something. And then also that academic type research where we deliver, we develop and tailor new or existing interventions. And that is it from me. So like I said, we will take questions right at the end. So please feel free to put them in the chat now or hold on to them. And up next, we have Steph join, who's going to talk about a research roadmap, who we think kind of takes the next step forward in terms of what we need to do to answer those top 6 questions. Thanks, Steph.
Share my presentation somewhere. Great, I hope that you can all see that. Yeah, so thank you, Tash, for providing that overview on the CHINRI results and the key research priorities for nutrition during middle childhood and adolescence. Following the identification of these research priorities, we developed a research roadmap to guide the efforts of researchers, funders, and governments towards filling the highest priority research questions. And the roadmap has just been published on the ENN website. And in this presentation, I'm going to give a brief overview of its content. So the roadmap focuses on the 6 priority research areas from the CHINRI exercise, providing a scoping review of what we know, as well as the evidence gaps and lessons learned from research in nutrition and other health-related fields, and a proposed way forward in the form of a research agenda to address the gaps and achieve impact over the next 10 years. As I mentioned, the highest priority research areas are covered by the roadmap. These were briefly presented by Tash, but include adaptation of antenatal and postnatal care interventions for adolescents, effective strategies for delivering nutrition interventions in schools, how best to engage youth in nutrition interventions and programs, effective behavior change communication strategies, food systems improvements to support healthy diets in schools, and optimal partnerships and delivery platforms for school-age children and adolescents beyond schools. Overall, these research areas encompass the top 5 priorities identified in the Chinnery exercise, the highest priority research areas for pregnant adolescents, as well as for those in and out of school, as well as the research areas deemed the most answerable and the most likely to improve equity and result in effective and deliverable interventions. For research area 1 on tailored antenatal and postnatal care, we found that the bulk of evidence focused on the uptake of antenatal care services by adolescent girls and the barriers that they experience to accessing antenatal care. However, there were evidence gaps around the access and barriers for postnatal care services. Evidence was also lacking on the impact and cost effectiveness of tailored antenatal and postnatal care services and how other adolescent responsive health service strategies, for example, those used in sexual and reproductive health services, might be applied to antenatal and postnatal care services. As a way forward, the research questions we have suggested to fill these gaps focus on identifying optimal and cost-effective packages of antenatal and postnatal care services for adolescent girls alongside optimal delivery platforms, exploring the benefits of including family members and healthcare providers in social and behavior change communication interventions, the use of existing community-based services or platforms to deliver interventions, and the use of electronic and mobile health platforms to educate, inform, and engage adolescent girls during pregnancy and postpartum. For research area 2, covering school-based nutrition intervention strategies, research largely focused on school feeding programs and weekly iron and folic acid supplementation, with research gaps pertaining to the prevalence of anemia and micronutrient deficiencies and impacts of supplementation during middle childhood, the minimum quality standards for school meals, how to address barriers to delivering weekly iron and folic acid supplementation programs, and whether we should be considering transitioning from weekly iron and folic acid supplementation to weekly multi-micronutrient supplementation in this age group. Suggested research questions to fill the gaps explore the minimum standards for school feeding programs, how best to contextualize and scale up weekly iron and folic acid supplementation programs, the benefits and cost effectiveness of transitioning to weekly multi-micronutrient supplementation, the burden of anemia and other micronutrient deficiencies during middle childhood, as well as the benefits of supplementation in this age group. For youth engagement, we found that evidence demonstrated the benefits of engaging school-age children and adolescents in a range of health interventions and programs. And there are many examples of youth engagement strategies, as well as of guidance and tools to support youth engagement, particularly related to sexual and reproductive health, mental health, and substance use, with a focus on high-income countries. However, we are lacking strategies, models, and tools specific to nutrition interventions in low and middle-income countries. More evidence is needed on context-specific barriers and enablers to sustained and effective engagement. And there's a lack of consensus on how to describe youth engagement in research and how to measure impact. As a way forward, suggested research questions focus on optimal strategies for nutrition interventions in low and middle income countries, and the barriers and enablers to sustainably engaging children and adolescents, and how they vary by context, age, and sex. There is a substantial evidence of using social and behavior change communication strategies in nutrition programs to promote positive behavior change. But gaps remain around mechanisms of behavior change to support improved diets for children and adolescents, guidance on developing context-specific content and intervention materials, understanding of effective mobilization strategies in and out of school, examples that engage community members in the design and implementation of interventions and programs, guidance on training teachers and staff at scale, and examples of feasible, acceptable, and effective media-based approaches in low and middle-income countries. To fill these gaps, suggested research questions focus on development of a common framework to design contextualized and effective social and behavior change communication programs, effective strategies tailored to rural contexts and those out of school, and understanding the feasibility, acceptability, and effectiveness of large-scale media-based campaigns in low and middle-income countries. For research question 5, research shows that healthy school food environments incorporate a range of strategies to promote healthy macronutrient-dense foods and restrict access to less healthy food items. But there's a lack of evidence from low and middle-income countries on the acceptability, feasibility, and impact of such strategies, including on implementing food standard regulations, placing restrictions on unhealthy food and beverages, as well as on the sale and marketing of these items, both in and around schools, strategies that link school food systems with local food producers, and interventions which promote good wash practices and adequate food storage, food safety, and hygiene. Our suggested research questions aim to explore what aspects of school food environments are associated with dietary and anthropometric outcomes in low and middle income countries, the impacts of school regulation interventions, and the potential benefits of interventions to support supply chains between local farming systems and school feeding programs. Finally, research area 6 of the roadmap focused on evidence from both structural interventions, including legislation, taxation, and policy implementation to support improved nutrition in middle childhood and adolescence, as well as community-based interventions to target social norms and nutrition environments with a particular focus on reaching those out of school. The research gaps included a lack of evidence on the impact of legislative policies and examples of effective social protection programs for this age group, the barriers and enablers that those out of school face to accessing services, and the impacts of contextualized community-based platforms. Our suggested research questions to fill these gaps focus on exploring the effectiveness of social protection programs to improve food security and nutrition outcomes, particularly targeting those out of school, the barriers that out of school children and adolescents face to accessing services, and what the optimal community-based platforms are to deliver scalable nutrition interventions beyond schools. Across the research areas, our scoping review highlighted some cross-cutting aspects to consider when designing and implementing nutrition interventions for school-age children and adolescents. Funding acted as a key barrier to implementation and/or sustainability across the research areas, and there's a need for future research to incorporate estimations of cost effectiveness to ensure suitability, sustainability, and scalability of future interventions and programs. Robust monitoring and evaluation mechanisms were often absent, and there's a need for research into what indicators and outcomes should be measured in this age group as well as how and when they should be measured. There's also a need for greater attention to effective engagement across sectors, including social protection, health, agricultural, and commercial sectors. So while I've presented the key findings across the research areas here, the report itself provides more detailed information on study design, methods, and context to guide research plans. As next steps, we wanted to highlight the importance of collaboration and coordination around the priority research areas to streamline and optimize efforts to address these and other research gaps. For those who are not familiar with the Global Adolescent Nutrition Network, or the GAN, as Tash mentioned, it is a network of researchers, programmers, government representatives, donors, and UN agencies coordinated by ENN. And the network provides a platform to identify emerging research, to share operational experiences, and to disseminate information. The GAN would greatly welcome expressions of interest to co-develop concept notes around the research questions outlined in the roadmap with its members. And we'd also appreciate hearing updates on how the roadmap's content is being used to shape research plans. And more information on this, as well as how to make contact, is provided in the roadmap document. Finally, I'd like to thank those listed here for their contributions to reviewing the roadmap and providing suggestions, as well as to acknowledge our donors who made this work possible. Thank you for listening.
Thanks, Steph, for going through that. And I see we do have a question from Natalie, but we'll come to those at the end. I can now welcome our panelists who, there were some challenges joining, but which is probably our fault, but we're not very technically savvy. But welcome to Caroline, to David, and also to Deepika. Thank you so much for joining us and for making time. I wondered if we could now just have sort of 5 minutes from each of you to speak to your thoughts quite broadly on research priorities for adolescent nutrition. Caroline, you're the most settled, having arrived at the beginning. Perhaps we'll start with you.
Sure. Thank you very much for the opportunity to share my thoughts on the research priorities. And first, I'd like to congratulate you and Stephanie on the incredible work done on the report. I think it will be a valuable resource for researchers who are working on nutrition. My quick reflections as I was reading through the research questions is really an appreciation of the depth that the team has gone into in terms of unpacking the research questions. And also for me, because I come from sexual and reproductive health, the sexual and reproductive health field, the focus on pregnant adolescents. Though I sat back and wondered, what about those who are parenting? Because when you look at the research questions, they focus a lot on antenatal care and postnatal care, given that focus on pregnant adolescents. But I sort of felt like those who are parenting are also a group that is vulnerable because they have young children. Many of them are in precarious economic situations. So I was just thinking about the value of also speaking to approaches that are outside antenatal and postnatal care to reach parenting adolescents in particular. And they are platforms that already exist. I think with sexual and reproductive health, there's a lot of life skills training, there are a lot of youth groups, and those might be avenues to reach pregnant and parenting adolescents and can provide them with opportunities not just to get, for example, nutritional education, but also things like income generations, because ultimately having access to nutritious food means that you have to be able to purchase it. So that's one of the thoughts that came to me about the pregnant versus the parenting. But I mean, it's also in line with research area 6. So perhaps it's more about outlining the internet connections between the research area. I think the second point I'd like to make is with respect to the second research area around the strategies for delivering interventions into school. Again, I'm not in nutrition, but as I read through this, I sort of felt, wow, there's such a strong focus on supplementation, but are those in school able to prepare food in a nutritious way? Are there ways for schools to sustainably have food anyway, like school gardens, and what might the impacts of those be? But again, that's linked to the food systems question. That's the 5th research area. So again, it may be about drawing the interconnections among those. So those are just some quick reflections. We can talk more after this round.
Thank you. Yeah, I think those are some really, really great points. Deepika, should we come to you next?
Sure. Thanks, Tash and Steph, for presenting an overview. And I think it was a marathon task to prioritize the various research priorities. And it also addresses the knowledge management agenda, which most of the organizations would be following. So from the presentations and all the discussions that we've had, I conclude 3 things and that are very important. First is, and it resonates with what you shared, is determinants. I think it is very important to have interventions which are not one size fits all, with a one size fits all approach. It is very important to understand the context and communities, because all of them are very different. So it will be very effective if some organizations and some group can come together and unpack the context-specific determinants and drivers of adolescent nutrition, which you also point out in the research priorities. And this could happen through partnerships with research institutes and universities. And it will also help us build the evidence base when we talk about reducing the triple burden of malnutrition in this age group. The second point I have is, as I mentioned, determinants. The second point is on delivery. You mentioned about the delivery platforms. I think we all voice our opinions on multi-sectoral platforms or multifaceted interventions, but it will be important to see that what impact a multi-sectoral intervention has on the nutrition of school-age children and adolescents. We still have to test that delivery and effectiveness, the cost effectiveness, and how it can be delivered through the various platforms. Then third is about, I think, data. What we see is that we mostly have data on 15 to 19, because that's included, and that's not very comprehensive, because 15 to 19 is included under the reproductive age group. So we have some data around that, but the data around the young adolescent or the early adolescents is missing. And their needs, their choices, their agency is very different from the older adolescents. So I think it will also be good to deliberate and to understand this age group and try to put in our efforts to get more information on the younger adolescents. And also for school age and adolescents, I think there are no targets. That's why when there are no targets, it also kind of, I would say, demotivates, because there is no accountability. When there are no global targets, there is no accountability. So I guess these would be important areas to consider when we go forward. Thank you.
Yeah, thanks for that, Deepika. Yeah, I fully agree with you. And now, David.
Sure. So first of all, I'd like to really congratulate the team, because I coordinated a couple of Chinnery exercises, and I know that they're not an easy thing that you do in 5 minutes in your spare time. So congratulations. And especially as you've gone, very unusually actually, you've gone beyond just ending up with your rankings, to actually come up with some practical suggestions of, well, digging into those broad research questions to suggest specific studies and even study designs that one might use to answer those questions. So I really encourage people to look in, not to just look at the initial headline rankings, but to look at these excellent unpackings that have been done within the report. So that's my sort of first point. Many congratulations on that. My second is just to emphasize, as has been done, but that there is sort of lots of research going on and has gone on in young child nutrition, and then there's increasing research, especially in high-income countries, but increasing in low and middle-income countries, in adult obesity and overweight. But there really is a need for this research. So we've got 6 key priorities here, and there are more priorities potentially below those. But they are, really, we just need more research done in this age group. And we're going to have to convince our donors and our researchers to make that happen, because there's so many unanswered questions here. So just to emphasize that. And then I guess a third point I wanted to make was that interventions really do need to be, interventions for and with children and older children and adolescents, need to be very realistic about how much control the adolescents themselves have over what their diet is and also their amount of physical activity. And this is a time when we can influence them for the future, no doubt. But in the short term, the parents and the people who are, for example, if you have a school kitchen that's giving food to the people, that in the short term, that might be incredibly important for actually changing what these adolescents are eating or what they're doing in the way of physical activity within the school context, but also through clubs. So those were just 3 comments that I wanted to make at this stage.
Yeah, thank you. Some excellent points all round, and so much that I think we could discuss. It's really quite a broad topic with a lot of holes, so there's lots to discuss. My kind of immediate thoughts from those comments are that in terms of Caroline, when you talked about parenting adolescents, I admit that's probably not a group I think about very often, and thank you for highlighting it. They are extremely vulnerable, and I think quite often when we talk about adolescent nutrition, it's in terms of the argument to galvanize donors and researchers, we often start with pregnant adolescent girls. There's quite clear implications for the next generation and for infants and children. So that one is a bit more of an easy sell. Then we talk more about the children and the adolescents themselves. Very rarely do we talk about the parenting adolescents. So yeah, that's a great point. And in terms of, Natalie asked a question that Steph typed an answer to in the Q&A about delivering of supplements in schools. And I think, Deepika, you also talked quite a lot about delivery and the gaps in delivering interventions in schools. The evidence is there for micronutrient supplementation to this age group, but the delivery is still not done well, and we have a lot of gaps in how to do that, even in primary schools, let alone secondary schools. I know that secondary schools are a massive gap in terms of school meals and supplements, but even in primary schools, and Nutrition International are doing a lot of really great work trying to get weekly iron and folic acid supplements onto the WHO essential medicines list, which would be a great start in terms of pragmatic issues that we come across when we're trying to deliver supplements in schools. But there's many more questions, and we hope that NGOs and governments, UN agencies that are involved in delivery could do some more kind of implementation research and share more learning. It doesn't have to be academic research, so that we can improve that. And in terms of, David, you also spoke about convincing donors and getting more research in this area. Do you kind of have any further thoughts, or do others have any further thoughts on how that might be done? I think from ENN's perspective, we also work quite extensively in women's nutrition, and we found a similar issue where, unless you're talking about the baby that's going to be born, it's quite difficult to convince a limited pool of money to be put towards an age group where the evidence about what the consequences are might not be so obvious or not so convincing. Yes, David, please.
Yeah, so I think that for donors, one thing which one really needs to have is some cost effectiveness studies, evidence and cost benefit studies. So if you put this much money into this intervention or this program, this is what you'll get for that. That to me it's not the only thing you need. You can pull the heartstrings, etc. Adolescents don't tend to pull the heartstrings, unfortunately. So, little babies that you can cuddle and everybody wants to help them, is a different matter from, what is people who are, adolescents. So I think really showing politicians that if you invest in this, this is the return that you'll get for it. In terms of persuading researchers, if you like, to do the research, basically the thing that talks is money. So if donors put out there a call for proposals, you will get proposals, probably a lot of them.
Yes, please, Deepika.
And just to add on to that, I think one more useful area of work would be, as I was mentioning, setting targets. I think it's because there are global targets for all the other areas, especially for young children and also for anemia globally. So that kind of motivates donors and funders because there is a target, and we are progressing towards the SDG reduction or prevention. And that motivates. But for adolescent and school age, there are practically no targets, and that is a key factor in bringing money and then accountability and credibility. So I guess as not only as researchers but as practitioners as well as policymakers, I think it's time to put our weight behind this narrative of having some targets at the global level. Thanks.
Yeah, you're so right, and it comes down to being kind of stuck in this catch-22 where we don't collect survey data because there isn't a target, and we don't have targets because we don't have much data. So yeah, I'm really hoping that's going to change, and the DHS have recently changed from using adult BMI for 15 to 19-year-olds to applying the WHO BMI for age Z scores, which is a really great start, but it's still just 15 to 19-year-olds. Caroline, please.
Sure. I just wanted to build on the point that was just made around targets, and also reflecting on one of the points I'd said, if there was time, I would come back to, is the intersections between nutrition and other sectors, including sexual and reproductive health. And I think I was just thinking in terms of donors being able to see the interconnections. Yes, you're working towards a target in sexual and reproductive health, but really nutrition has a part to play in that, because many times you'll find that they are young people who will engage in risky sexual behaviors, for example, or move into child marriage because of issues of food insecurity and nutrition. So I sort of think there's also need for work around the interconnections between different domains.
Yeah, 100%. And it seems especially important for this age group who it's quite sort of multifaceted, and there isn't an obvious anthropometric programs that, you know, if you're this way, go here, if you're this, do that, that you might have for babies, or a clinical program. It's much more multifaceted, and we need to think multi-sectorally, which is really, we struggle with in nutrition generally. So yeah, that's a really good point. And we had a question in the Q&A, yes, which kind of relates about the management of acute wasting in adolescence. And I suppose this is probably a much more direct delivery of a nutrition intervention, rather than that kind of multi-sectoral stance that we do need to take. But there is emergency contexts where we do have very thin or wasted adolescents that we don't have programs for. And ENN is going to be doing some work, starting with a review on a mid-upper arm circumference cut-off for this age group this year. So that will be great. And yeah, I'm just in the question. Oh yeah, I was wondering whether supplementation is enough. Yeah, in terms of micronutrients, yeah, do we need macronutrient supplements? I feel like we're quite a long way off kind of designing an intervention like that. But I think it also makes me think about, beyond supplementation, school meals, and how our school meals, they're great for attendance and for education outcomes, but are they good for nutrition? And I think they could be a lot better, and could help towards both low-income settings where children and adolescents might not be receiving enough calories, and like David said, also other contexts where we're setting healthy eating habits and influencing diets for the long term. So I think school meals in terms of macronutrient supplementation could have such an important role in school age and adolescent nutrition. Deepika?
Yeah, and I think through schools, we are talking about supplementation. We are also talking about deworming, and then we have school meals. But I guess school is also that platform where nutrition education is delivered. Now, when I'm talking about nutrition education, it's just not key messages in a few subjects. It has to be meaningful and age-appropriate nutrition education. I think there is enough evidence which indicates that meaningful nutrition education, age-appropriate nutrition education can help improve practices and behaviors in the long run. And that depends on, what is the frequency, if parents are engaged, how participatory is the curriculum. So I guess there is also room for improving the nutritional, I would say, status and behaviors of school-age children and adolescents if nutrition education is done well through schools.
Yeah, that's true. Yes, go ahead, David. Oh.
Also, to just related to the school meals, I think a common missed opportunity is to use the school meals as an opportunity for students to get involved. So that they actually help with deciding what the meals are, but clearly, there has to be some constraints on what they're allowed to choose. It has to be realistic in terms of being cheap, but it also has to be nutritious. And so to use it as a learning opportunity, but also to get their buy-in and for them to see the importance of the theory that you're giving them in any sort of nutrition education, and what does that translate into. So that it isn't just salsa and beans, that it goes a bit beyond that to really thinking about what a balanced diet is that could be cheap enough for people to include within a school meals program.
Yeah. There's a point been made in the chat about the School Meals Coalition Research Initiative, which is a lot's happening in that space. So yeah, we're seeing, hopefully going to see some great improvements. There's a question in the chat about how much is being done around adolescent boys. And I think this is something we often have tried to promote at ENN, but equally there's limited resources, and we have so many unanswered questions in terms of adolescent girls, etc. Caroline, I wondered, is it something, a kind of issue that you also face when you're thinking about adolescent sexual and reproductive health, how much you put towards boys, or is it's equal, there's no issue? Are they neglected in your space as well?
No, it is an issue. Even when you look at much of the funding that's available for programming on adolescent sexual and reproductive health, it is targeted towards adolescent girls because of the impacts of early marriage, early childbearing, etc. And yes, in the studies that we've been involved in, we have faced a lot of pushback from communities asking, what about the boys? So I think it's an important question to ask, because ultimately, I mean, when we think about sexual and reproductive health, adolescent girls are having sex with young boys, and there are implications for them as well. We may not see those effects immediately, but that doesn't mean that in our programming we shouldn't be reaching out to adolescent boys. And I think it's the same for nutrition. And I was just reflecting as David was speaking about school programs, and where young people are introduced to farming as a means of getting food. Within APHRC, the African Population and Health Research Center, there is a group that's really looking at urban agriculture and promoting that. And I think that's one intervention where both boys and girls can be involved in growing your own food for your own benefit, but hopefully also getting extra for income, because we know that as well, employment is a challenge in the setting that we work in. Yeah, thanks.
Yeah. Do any other comments on adolescent boys? Because I mean, they were included in our itinerary, but they did not really score very highly, to be honest. A lot of the high questions were, well, I suppose, not gender specific in terms of reaching lots of adolescents and school-age children via schools, reaching out of school vulnerable individuals, and then supporting pregnant adolescent girls were kind of key themes that came up. David or Deepika, do you have any thoughts?
Yeah, I'm happy to just say one thing, which is clearly anything related to pregnancy and childbearing and so forth, the key priority obviously relates to girls because they're the people getting pregnant. Related to the long-term, many of the long-term effects of overnutrition, they are more prevalent, the bigger burden in men later on. So things like the coronary artery disease, many of the, obviously not breast cancer, but some of the other cancers, strokes, diabetes, deaths from those. They're at least as bigger burden in men as in women, and often a bigger burden. So although there's all the stuff related to pregnancy and childbearing needs to have a particular focus on girls, absolutely, it's completely correct. Ignoring the nutritional status of boys and in the long term, is not a good idea. So we do need programs that are focusing on both genders equally, I would say, apart from obviously the stuff related to pregnancy and childbearing.
Yeah, great point.
And also, I think, Dash, there are some countries which have been implementing programs. For instance, India, they have a large-scale program where supplementation and a package of nutrition services is provided to boys too. So I guess it's also important to assess the effectiveness of such programs and to build the evidence around such programs, and then share it with donors and researchers to gauge their interest and work towards it in the next few years. And that would also be kind of a good motivation for many countries to follow suit and include adolescent boys into this priority agenda.
Yeah. Okay, I've just noticed the time. I was just kind of enjoying the chat, but we are at the top of the hour, so thank you so much to everybody who joined, and for all the comments in the chat. If we haven't got to those yet, or I look forward to reading back over the chat thread, which will be saved, and some really important points were shared there, and a recording will be shared, and the slides and the papers will all be available. So we'll make sure that participants get an email about those. We do have a quick poll before you go, which is for participants about which research priority they found most exciting or most interesting. So if you would click on that before you go, that would be great. Here it is. Everyone has the opportunity. Oh, except hosts and panelists can't vote, it says, but everyone else can. We'll just give that 1 minute and you can see the results. Okay, Annabelle, I think you can close the poll when you'll see that some people have answered. Do we have results, Annabelle?
Hi, Tash. There are still some people answering, so I'm just going to leave it for another 10 seconds or so,
Okay.
and then I'll close it so we can hopefully all see.
Okay. Yeah, there were some wordy questions.
There's still people completing, so I'll leave it a little bit longer.
People have other calls to get to, you know.
Okay, I will end the poll there. Thank you everyone for filling it.
See. Okay, well, quite an even spread. But adolescents answering, kind of creating their own solutions as high as is behavior change, communications and food systems. So that's interesting. Okay, yes, thank you everybody for joining. Thank you to our panelists for giving time. Thank you everyone for listening and answering questions. So see you all soon.
Thank you.